So what we're going to go through here is improving distal fib mobility. So when your heel hits the ground, tibia has to internally rotate, midfoot has to collapse and spread, talus has to move posteriorly and inferior, and your fib has to move posterior and superior for everything else to work how it needs. Now, what I tend to find is that patients who've had an ORIF through tib fib, like a trimalleolar fracture, they tend to have a lot of adhesion through their fib. Also, patients that have had chronic ATFL injuries will just have so much tightness through their fib, and they've seen a lot of different PTs, and they're working through talus and a lot of different dorsiflexion exercises, but no one ever touches their fibula. So what we're going to do here is I've got a TheraBand. You can use a stretch strap too, and I'm just winding him up through in-range dorsiflexion. And then from here, I'm going to take his fibula and I'm just going to palpate first. So I'm going to move superiorly and posteriorly. So for him, he's actually limited through superior fibular mobility. So I'm just going to hold a dummy thumb right along the inferior aspect of his lateral malleoli, and we're mobilizing, hold a little bit tighter, yeah, through a superior fibular mobilization here. Okay, and then what we can do is have you press down into the band like you're pressing on a gas pedal. Good, and then relax. When you press, just don't go as much. Just do it nice and light. Good, right there. And all I'm doing here, relax, is maintaining, pull it all the way up, all the way. I'm just maintaining a superior glide of his fibula. Do that again, push down a little bit. I'm maintaining pressure. Good, relax. Pull the band as much as you can and pull your foot all the way. There you go. Let's try one more. Push and relax. And that whole time, I'm just applying pressure. Now, if he had more of a posterior restriction, we'd do the same thing. So I would just take my thumbs, apply pressure where you feel the most restriction, and then same thing. You're gonna wind up first. Okay, press down into the band, and then I'm just applying a straight A to P glide while he's doing a little bit of contract, relax. Good, relax.